Good evening. We are in hour 3. Today is the State of Black Health 2024 for blackdoctor.org. I am your host, Dr. Renee, and this one is called Healing Together, Overcoming Chronic Diseases in the Black Community. So, needless to say, there are a lot of chronic conditions in our community, so we have 3 fabulous doctors that are going to talk about them. Before we do that, though, please share this broadcast because I know that you have some family member with something, diabetes, asthma, anything, lupus. There's so many chronic conditions. Just please share the broadcast. I don't care where you're watching from. Share it, share it, share it. And if you have questions, you can type them in the chat. I will try to get them addressed. Let us know where you're watching from. And those that are watching the replay, thank you. And let's get started. So today we have Dr. James Thompson, Dr. Cree, and Dr. LaTanya Riddles-Jones. So fun fact, Dr. James Thompson was my allergist. He's leaving me, but I'm still, I'm not right, but I'm going to get right. But so Dr. James Thompson and Dr. LaTanya Riddles-Jones have both been on before, but Dr. Thompson, please tell everyone just a little bit about yourself.
Oh, sure. First, thank you for the invitation. I really appreciate being among such esteemed companions here. So I originated in Chicago. I'm a native Chicago public school system. Went to a school called Lindblom Technical High School, and went to University of Illinois for my training in a pre-med program, and then matriculated there to go to Washington University in St. Louis. Spent 4 years there and graduated 1980, and then went to University of Illinois in Chicago. Spent 3 years there in internal medicine residency, and then stayed an extra year for chief residency. Then went back to Washington University for training in allergy and immunology, and then joined a practice that I am still with 34 years ago, practice of allergy and asthma and immunology in the Chicago and greater Chicago area. I was working out of 3 offices, but now as I kind of have reached my waning years in practice, I'm in one office in Orland Park. So that would be my story. I'm also a medical director of Healthy Living with the Vision Foundation, and we address healthcare disparities wherever we find them, regionally and online. So that's nationally, internationally. And we're just about 3 years into it, and that's been taking up a lot of my time also. Thank you.
Okay, Dr. Cree.
Hey, I'm Dr. Cree. I'm a board certified family medicine physician. I specialize in helping everyday overwhelmed, overworked individuals learn to live a healthy, happy whole life. I hail from Birmingham, Alabama, where I am the sole owner of Brownstone Healthcare, which is a direct primary care practice. I'm the medical director for the City of Birmingham's Employee Health Clinic and the medical director for the Living Well HIV and PrEP clinic. So I do lots of things, and prevention is my game. Thank you for having me, Dr. Renee.
And Dr. LaTanya Riddles-Jones.
And so I was so happy to hear prevention is your game because that's my game too. So
Hey.
I'm Dr. LaTanya Riddle-Jones. I am a professor at Wayne State University School of Medicine, the Associate Center Director for Diversity, Equity, and Inclusion for the Carmenos Cancer Institute, which is a comprehensive cancer center here in Detroit. Hail from Inkster, Michigan State undergrad degree in my chemical engineering, MPH at Harvard, and just, Wayne State is my pride and joy right now. I'm teaching 60-70% of the time, and I love it, but I'm internal medicine and pediatrics trained. So a little bit about me.
Thank you so much. See, I told you guys I brought some really great people today, so I am so excited. So let's start out with what are a few of the chronic conditions that you guys see that are in our community? Whoever wants.
I see a lot of high blood pressure or hypertension, a lot of diabetes. I can see that all day long in different shades, shapes, form, and sizes. So I'll stick to those who, and high cholesterol being the big three that I see on a regular basis.
Now, I think that you just blew some people away because I don't think that they realize high cholesterol and high blood pressure were chronic conditions. So I'm very glad that you said that out loud. because I think people, and even diabetes, you know how people say I have a little sugar?
Just a little sugar.
Diabetes is a little more serious than a little sugar, you guys. We need to take it seriously too. So, and then also, because you both ladies talked about HIV, I think a lot of people seem to think that it's gone. All we have to worry about now is COVID. No, 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 no.
No, not at all. And HIV is a chronic condition now. We are able to manage HIV really well with medications. And so my patients who are, living with HIV, they're managing their HIV really well, but it's the diabetes, the hypertension, the hypercholesterolemia that Dr. Creed mentioned that still seem to be the problems. And I want to add on depression. Let's add depression on there as a chronic condition.
And so, Dr. Thompson, the reason why I go to Dr. Thompson is because I have asthma, and so most people don't realize that asthma is a chronic condition. That you don't have asthma. You don't grow out of asthma. You just have controlled asthma, like I do.
That's very true, and it's probably even to this day with all the advances, it's underdiagnosed. A lot of people I still run into that don't have the diagnosis, but have this long history of coughing every time they have a cold and missing days of school or missing sometimes several days of work, but they have bronchitis, they've been told, and they've been given antibiotics and all kinds of treatment. My wife was one of them years ago. I've been married for 37 years, and she when we first met, she had a history of bronchitis since she was 16, and not continuously, just every time she has a cold and seasonally, but she hadn't been diagnosed. So she's just one example of many, because you can cough and you don't have to wheeze, you don't have to have shortness of breath or chest tightness. All those are all symptoms of it. But it's a syndrome, and it's a syndrome that can get better even on its own. And sometimes that's why some people think that they have something else, but when they have a severe case and they have to go to the emergency room or hospital, it often gets exposed at that time. So it's still undermanaged and underdiagnosed, but yet there have been lots of advances now to keep people more comfortable, keep them at work and at school, so that they can use preventive medications and preventive household changes, like preventive care at home, where they can reduce their trigger factors once they've identified them. So we've come a long way.
Yes, because I actually had perfect attendance all 4 years of high school, but I think I probably had it all the way through at least most of elementary, because I would get sick at night and I'd go to school the next day. I was really big on school. I was like, and when I missed school, 5th grade, I was in the hospital for 5 days. So that ER visit led to an ambulance ride to the children's hospital. So, but yes, very well controlled. I don't take daily medications anymore, but I tell you, exercise is what saved me, I do believe, because I started this crazy thing called running. But yeah. So, can you please, and we've had several shows about it. We actually just had a show on National Black HIV/AIDS Awareness Day about PrEP. So, can you two ladies please educate this audience here about PrEP and how amazing it is in us to be able to get this far to discover this?
You take it away, Dr. Jones. I'll pick it back
You'll
up.
add on. All right, not a problem. So PrEP, there are 3 medications that are approved for PrEP, for pre-exposure prophylaxis to prevent the acquisition of HIV. They are 99% effective if taken as prescribed. And so we have 2 that are pills that can be taken daily, and another medication that is injectable. And that injectable medication can be taken once a month or once every 2 months. And so that's changed the game. I have patients who travel internationally. They need their PrEP, their medications, can't get the refills internationally. And so they get that injectable medication, and they can be across the globe trotting for 2 months before they need a refill of their medication or a new dose of medicine. Right now, the population that I really want to encourage to take up PrEP is Black women. It gives you some power. I have many patients who are in relationships where they don't feel empowered. They feel as if they are, at the beck and call of their partner, and really, you don't have to be. So just PrEP is just changed the game, and the injectable medication is amazing. So I'll let Dr. Cree take it from there. But
I would add that you may have to be creative with getting your prep. I'm in Alabama. We in the Bible Black belts
mm,
of the world. So a lot of primary care physicians do not necessarily feel comfortable with writing prep. So I have a lot of people that come to our clinic. We do a night clinic, so we got a non-traditional clinic. So I have people come as far as counties away, Talladega or Atlanta, you name it, they drive into our clinic, maybe Mobile, even as far south, because one, it's getting you out of your neighborhood to get your medicine. And two, you just may not have providers that are comfortable in that regard. So don't get discouraged if you find that if you ask your primary care about it or your GYN about it, and they say they don't do that, there is someone that can do it. You have to drive a little ways. You're talking about visits every 3 to 6 months, usually every month, but it is worth taking that drive. It is worth empowering yourself and taking your sexual health by its horns, you being your own advocate. And yes, most of my patients are not women, and I would love to see more and more women, Black women, getting the prevention and the protection that we need.
So when you say it's a shot, do you have to? The doctor has to administer the shot, or you do it yourself? What is?
Yes, the doctor has to administer the shot.
Okay.
so you go into the clinic to get the medication.
Okay.
And these medications are covered. They are covered by insurance. They're covered by Medicaid. And so that's the big myth is, oh, these expensive, they're the expensive medications. They used to be. But
Mhm.
they're covered now. So everyone has access.
And even with us, for people that don't have insurance, there are
Mhm.
grants. The pharmaceutical companies have programs. So no matter your situation, go ask the questions, get comfortable with somebody that you know that you can trust to say, this is what I need. What kind of resources can you help me get to use this, because it is a great medicine to have on.
hmm And don't let anyone tell you you don't qualify for it.
Correct.
Thank you. Everyone
You know,
qualifies
and
for it.
they, and I don't know if people paid attention. There was commercials when they first started coming out,
Still
hmm
commercials.
and the commercial specifically said you had to be, I think, born a male or something, and I was like, oh,
They dropped the ball in that regard. I think with the advertising, because when people think of it, you mainly think of men who have sex with men
hmm
or transgender, male
right,
or female, and like, no, we need more commercials, different commercials, because and then now you'll see if you watch.
yeah. Now they've changed.
Now it's changed, but still, that still seems like the overwhelming. You don't just
hmm
usually see just a woman and a man. It's usually a variety of relationships, on the commercial. So people still probably are tuning in that part out.
And I don't know, they just weren't specific. I didn't know what they were talking about until I talked about it on Black Doctor with a pharmacist.
Mm.
I was like, that's what she's an HIV pharmacist, and I was like, oh, I didn't have a clue. I said, I've seen the commercial. I didn't know what they were advertising for.
And you a whole doctor.
Exactly.
Mm. Right.
What's this drug and what? And I mean, I never could understand what are they talking about. And I was like, oh, and so yeah, and so now I think that's really important that we just make sure people understand any and everyone can use these drugs.
Yes.
Down to age 12. Okay.
Oh,
The pediatrician in me wants y'all to know if you're 12 and up, you can get this medication. It is effective
That's
and
amazing.
look
covered.
at that.
hmm
Okay, so and then of course we know next month we have Women and Girls HIV/AIDS Awareness Day, and Black Doctor has a couple of things planned for that as well. But so you brought up a very good point, Dr. Cree, about medication. So Dr. Thompson, you and I both know some of these meds are ridiculous in price, and I have good insurance.
Yes, you're absolutely right, and I'm finding it more and more challenging every day to select a medication not only that's appropriate for my patients, but that they can afford, that they have access to. And it's becoming more and more difficult as insurances increase deductibles and And as the prices of these medicines go up and co-pays go up, so it's become very frustrating because here it is, we have, you know, a smorgasbord of various medicines that you can tailor to people, antihistamines and nasal sprays and inhalants, but they're becoming less accessible because of cost. And here it is, we're trying to prevent. And if we can use medications to control our airway problems, then there won't be these attacks that end up having you miss nights of sleep or miss school or work. Yet, if you can't afford these controllers, you're going to be in trouble. And a lot of times it comes down to, okay, do I go get this medicine or do I, pay my heating bill? So it is becoming more frustrating, and we have to be more creative. But we also need to be probably a lot more vociferous about how these companies are doing these things. The political aspects of this. We need to become actively involved, meaning doctors, in stopping this escalation of prices that happens primarily in the U.S. You cross the border, different story.
Yep.
So
I'm headed to the Capitol in May to do my diligence. Last year we talked about SMART, the system for the medications, and we talked about how they need to allow doctors to be able to go in at level whatever rather than having to go through the whole thing, and insurance should cover it. Because if your doctor knows that the level 3 drug works for you, then they should not have to go through 1, 2 to get to 3. But in order for it to be covered by insurance, you have to go through 1, 2, 3, which is just ridiculous. But that's the way it is. And Dr. Cree said exactly what I did with my dad. We had a medication that was, I think for the 3-month supply, it was over $1,000 or something. It was crazy. And I went and looked up the medications. I looked up the pharmaceutical company and found something online, and they text me, instead of mailing you a card, they text you the little number. Took it to the drugstore, and huge discount. So you have to really do what you can. And that reminds me of high blood pressure. I was in did you know this, Dr. Thompson? Inglewood is has the highest rate of stroke deaths in the country. You knew that? I didn't know. So I went, and we were at St. Sabina, and Amron was giving out blood pressure monitors, and I was doing blood pressure readings, and there were so many people who had 200 over 100, 200 over 90. And I was like, oh my God, we need to have the ambulances lined up.
Walking around. They just walking around.
Well, they've been living like that for years.
That thermostat has reset. Like,
I'm over here nervous. Like, are you having headaches? Are you seeing double? Are you okay?
no.
So what a lot of them were saying was that they had skipped their medications.
You got to make them last. You got to stretch them out. Unfortunately, that's the thought.
yeah, the atrocity is that in Inglewood, the average lifespan is just mid-60s, and you just go a few miles down the road to the Ivory Coast or to Streeterville, and it's in the 80s, right?
Wow.
And it just blows me away because hypertension is preventable and very treatable with diet and lifestyle. And conventionally trained doctors like myself don't get enough training in nutrition.
None of us, not just yourself. None of us.
Right.
None of us at all got that.
No, and I stepped outside the box about 6 years ago and got training for a year in integrative nutrition, and it just opened my eyes to how blind I've been. I used to think that once I prescribe, as I say, I'm an internist also, and I would occasionally prescribe some blood pressure medication, and I would tell patients years ago, well, that you're going to need this for the rest of your life. I really believed it, but that's how I was trained. And type 2 diabetes, same things, but these are actually reversible.
Mm-hmm.
And if you've had them for a number of years, not 100%, but greater than 70% of the time, you can get off medicines. And I'm living proof of it because for 25 years, I took 3 blood pressure medicines and a cholesterol medicine. And once I went totally whole food, plant-based, within about 6 months, I was off all of them. And my numbers are better than ever.
He's a Pelotoner too, Latanya.
So we need to, I've integrated this into my practice. When you eat healthy, your asthma's better controlled. When you're not sucking up all the milk and dairy products and cheese.
The inflammation is down. Yeah.
Oh my gosh. COVID is better. I mean, there's studies that show that you are more robust against COVID if you eat less meat and a whole lot more plants. So a lot has to do with our food choices and what we do, what we don't do. You mentioned already, Dr. Renee, about exercise. It's so important. And
Mhm.
so is sleep.
Oh
Yeah,
yeah,
Yeah.
so important.
and water.
Hmm.
Yes.
Basic things.
Mhm.
Breathing.
Yeah, that we forget about.
That
Oh,
we exactly, Dr. Cree. Everyone says, "Oh, I can't because I can't afford this, or I can't afford to eat like that. I can't afford to exercise because I can't afford the gym membership." You don't need any of that.
mm-mm, mm-mm. Just the
Although clean water is skeptical in parts of my state, right, Latanya? But
Yeah, a little bit.
so that could be an itsy bitsy problem because you might have to buy water over there. But
Mhm.
water is so essential, and you could just walk.
mm-hmm,
It
mm-hmm,
is amazing what just walking can do.
mm-hmm.
And I understand you may not be able to walk outside your door. Okay, walk
Mhm.
around your apartment, house, condo, whatever it is.
Yes.
Walk in place in front of the TV. Just walk
Mm-hmm, mm-hmm. You
because
can
you
use your
can
YouTube.
stop those blood pressure medications.
Hmm. There's so many things that they can do. I'm always like, well, if you can't get to the gym, you can YouTube. Everything's in YouTube. Put your exercise, put your I'm on a chair exercise because I got bad arthritis, and it'll give you something to move your
Mm-hmm.
arm, kick your legs. So there's so many different ways that we can to do better. I do want to add that there is a diet out there called the Eat Right for Your Blood Type, the blood type diet, and it is really good as well. It's more used, overseas. Japan is big into that. There's an app called Eat Right for Your Blood Type. So if you know your blood type, you can put it in there and it says what are green foods that are help you, yellow foods that won't hurt you but won't help you. Put it in, it says red foods that you should stay away from. So that's something to add to
So
eat.
that's science based because I've heard about this book way before I even went to med school. I heard about that book.
To use it. I actually have done it, and I feel so much better eating right for my type. So I think talk to your physician, of course, about it, and come up and see if that's a great plan for you. But yeah, I feel good when I eat right for my blood type.
And then, Dr. Thompson, I have a question. This is probably the silliest question. Why do we use the word plant based and not vegetarian or vegan?
Well, vegetarian, I'm not muted, am I? Okay. All right. Well, vegetarian has some other implications because vegetarian
They
can be
usually
broken.
eat fish.
Yeah, well, the pesca vegetarians and
Oh,
pesca
okay.
meat.
Pescatarians.
Yeah, then you have the lacto ovo vegetarians, and they eat milk and eggs, but they don't eat any other meat, fish, those. So you have these subtypes. So vegetarian doesn't necessarily mean whole food plant based.
Gotcha.
And I generally like to use that full term whole food plant based because vegans are plant based, but not necessarily healthy eaters. You can be a junk food vegan
I agree.
because it's a social justice movement. It's not a diet. It's to save animals from slaughter and abuse and exploitation. And so if you drink Coca Cola and eat Oreo cookies, you're a vegan still. There's no animals dying from that or
Right.
being exploited, but your heart and your cancer risk and all that will still be high and risk of diabetes. So healthy vegans actually eat whole food plant based. So
Mhm.
that means minimally processed food. And plant based, meaning that it came out of the ground, is something that does not have a mother. It came out of the ground. And generally, anything that comes out of the ground that doesn't have a mother, you can pretty much say is plant based if it's an edible. And it's 20,000, there are about 20 to 40,000 choices out there. People think I'm going to miss my meat and all that. But every quadrant of plants has protein. The greens and other vegetables, the fruit, the whole grains, and the beans, they're all plant based and they all have protein. The last thing you're going to be in this country is protein deficient. Now you may be tired and feel like, oh, I miss this meat because maybe you started off raw vegetarian and you eat nothing but plants and fruit. Well, yeah, you might be missing some protein and some stock there because you really need to have a more balanced start with some beans. Pick your beans. Whatever, there's like 12 different kinds of beans and whole grains, not the white flour, the quinoa and
Mm.
teff and sorghum. There's several different grains you can have out there that are very healthy. They will fill you and your gut will like it because I think the greatest area of research in the last decade has been on that gut microbiome,
Mhm.
and it
Mm-hmm.
is like second to the brain and what makes you who you are. So it's very important since, and we're talking about COVID and HIV. Well, 70% of your immunity is in the gut, and as an
Mm-hmm.
immunologist, I really appreciate that because I learned that a long time ago that gut, those patches down there, really dictate your level of defense. And so, what goes down in that gut every meal is important. So make it healthy.
Yes, yes, yes. I don't know if that plant but
Well, if not plant based, just I tell my patients to shop the perimeter of the grocery
yep,
store.
yep.
Just start with that.
Hmm.
My medical students look at me like deer in headlights. Like, what are you talking about? Never heard that. My mom told me that as a child.
Right.
So just you won't have the processed foods if you shop the perimeter, at least for the most part.
Whole part.
Mm-hmm.
Yeah, I just saw something. Three things that mimic fish because I'm allergic to seafood. So jackfruit, banana blossoms, and lion's mane mushrooms.
Wow.
So that's my new thing I'm gonna try. I
Yeah.
unfortunately the local grocery store had none of the three. So I think I'm gonna have to go to a special grocery store. But I'm
Yeah,
gonna try.
sometimes you have to work a little hard to eat
Mm-hmm.
healthy,
Mm-hmm.
but I know it is about substitutions because that jackfruit it can taste like some pulled pork. If you know what you're doing, you use that sauce. Yes, that jackfruit, it
Mm-hmm.
doesn't look good. I mean, I went and saw, where's this jackfruit in the produce section? It looked like a watermelon that had chicken pox. I mean, I was like, wow. Um, but it's not the outside you eat; it's the inside. And when you go through some recipes, there's some great sources: Forks Over Knives. There's something called the Whole Food Plant-Based Cooking Show on YouTube. There's some Afro Vegan Society. There are a lot of resources at PCRM.org on YouTube. They have a whole section on recipes. So it's really just a matter of making those substitutions. You can have your dessert, nice cream, taste. I mean, people think, oh, well, frozen bananas is going to have a banana taste. Not frozen. Something about when you freeze it and cream it up and put some strawberries or blueberries or some cacao in there, some vanilla extract. You got to shake a healthy shake instead of that dairy product that's going to, increase your risk for for men prostate cancer, even some evidence for women some breast cancer, and so it's really just about substitutions.
Yeah, and I mean I'm all about I do a lot of substituting because I try to stay on the right side of things and I don't want too much of this and too much of that. Too much of anything is a bad thing. So,
Yeah. Well,
but
it's a wonderful thing when I can tell people they don't need to take their controller inhalers anymore because they stop the dairy and the cheese and the highly salted and processed foods. And then they tell me, you know what, my face is clearing up too. I'm like, oh, really? You don't have those bumps on your face?
Mm-hmm.
It's great.
The eczema's controlled, right?
Right. Yep.
Mm-hmm.
yeah, and
That's
I drink only oat milk and that started somewhere around 2016, 2017. And I was a 2 gallon a week skim milk drinker. I loved it. And then I went without it for like 90 days. And when I went back, I was all of a sudden, I was like, wait a minute. I haven't done that in so long. I'm like, what is that? And I said, oh my God, they're right.
Yeah.
And so
Yeah.
I'm a
Great,
famous
great,
person.
great grandmas used to say, cut that milk out when you got the flu, you got a cold. They would say, stop giving the milk. It makes mucus. They knew what they were talking about.
Yep. Clear liquids. Yep. Jello
Yeah. Some
and
broth.
water and stuff. Yeah.
Yeah.
So hypercholesterolemia, how can we combat that? What are we eating besides plant based?
I was about to say, I think y'all just gave us a whole lot of things. I mean, that is probably the way to go. And I'm always like, think about your fats. If we just cut bacon out, we just didn't have bacon in Alabama.
That's so hard, but okay.
I know, but I'm like, if we just cut back on our bacon and our fried chicken, the way we prepare things around here in my state, I think our cholesterol numbers would be much better. But you guys are probably in healthier states than me in the obesity capital of the world.
Mm.
But I'm like, watch if we fry everything. cause of your good cholesterol, you need to increase the good cholesterol, let's increase this. And they're like, well, I'm eating fried fish. I'm like, okay, not that kind of fish. And you got the Catholics that do in our hospital system, you have fish every single Friday. And then finally they start adding some baked options. So I think that it is going to be thinking about the way we prepare things and bag up off our bacon. That's what I recommend.
So I am a huge proponent for the air fryer because I do like fried chicken, but the air fryer makes you think. It
Yes,
has not even, I mean, I think if I put a tablespoon of oil in there, that's a lot. I don't think I even put that much.
exactly. That is a very good alternative to get that fried chicken taste. But I don't know, it's a struggle. I'm begging folks to get air fryers and put it in the oven and do
And
some.
you can even bake it in the oven too, because before the air fryer, I baked my fried chicken too. I've never fried chicken a day in my life, I can say, and I love fried chicken, but I've never fried it myself because I think that it just looks very scary. And
I've done it once, so I agree with you.
I'm in Alabama, so you know I fried chicken.
my grandmother's from the South, and we do not recall her frying it either. My mother doesn't either. So
Neither does mine. Mm-mm.
I think that that was just, as a matter of fact, grandma, I would, and this is, she was a great grandmother, but, I would sing in the choir and she'd say, okay, let's go get your KFC, Renee. So,
Okay, that was a wow. Reward.
it was.
Yeah. No, the exercise is good to combat it as well. You've
Right.
got to get that HDL level up, right? And so
Oh, see,
that'll actually
exercise, I didn't know.
combat.
See, exercise can help with that too.
Absolutely. But also, the thing we don't talk about enough is family history. Family history plays
Yeah,
into hypercholesterolemia significantly.
that's
I
so.
remember my first cholesterol test was in eighth grade, and my numbers were elevated.
Mhm,
It didn't make sense. I was an athlete. My BMI, my body mass index was normal. So where was that coming from? That was coming from my maternal grandmother.
mhm.
So you got to know your family history. We got to talk to each other.
You're right.
That's
Yep.
good. That's
And
so.
that's why it's important to get checked because that's
Mhm.
you get those numbers. Those are important numbers to look at, not just your total cholesterol, but your LDL cholesterol, and realize that if you have used just that you're using just that air fryer with just maybe a teaspoon of oil and you're doing all these things, you're exercising, you're eating a lot of veggies, and that cholesterol is still 220, 230, you got to do more. You're going to have to give the chicken up. You're going to
Mhm.
chicken just has about 6% less saturated fat than beef, okay? So if you're making it work by moderately changing your diet and your numbers are good, and you got your weight down and everything's clicking, fine. If your doctor says everything's fine. But if they're not, then you're gonna have to go further. And that's what I had to do because I did all those things. I was eating just lean pieces of meat. I stopped eating all beef and pork, and I just couldn't get off those three pills. I got it to the lowest level. But I couldn't get off those three blood pressure medicines, or Lipitor, or Torvastatin, I guess I should say. And so, but it wasn't until I went all the way, when I went all the way, that I was able to get off and stay off the medications. And I don't want to look back. And once you get away from these things for a few months, you don't miss them. I grew up on fried chicken. I grew up on liver. I loved all this stuff. My palate could take anything. So I didn't except chitlins. But but I you know
Good liver already. Good Lord. You might as well eat chitlins.
I know
I
that's
could I
right.
could I couldn't take this well. But really, I don't miss those things. I crave plants now. My taste buds have come down to earth because I used to eat a whole row of Chips Ahoy. That was after dinner. I mean, a row of Chips Ahoy, three Snickers bars. That was
Wow.
that was just like heaven to me. But I don't miss those things now because my taste buds aren't oversensitized by this high
Hmm.
sugary stuff that we get, that gets in our eyes. When we look at commercials, when we go billboards, when you go shop, what's the last thing you see before you go to the cash register? All the
Again.
Those
rainbow,
candy bars.
rainbow of
Hmm.
processed
All that
sugar.
sugar.
Oh gosh!
Mhm.
And right, the kids level. They have them down low where the kids can
Hmm.
reach it and all that.
They do
They know
everything
what they're doing.
strategically. They know.
Right.
That is too funny. That is too funny. But you know that there's some vegan chitlins, right?
Yes, I do know about
Why?
that.
I'm glad you know about
I
that.
do know
Why?
about that. I wonder about those, but I'm not a connoisseur in that area.
Yeah, I didn't. I wouldn't. I mean, just like I said, I never had fish, but I was like, this whole little fish thing sounds interesting. But I have no interest in the whole chitlin thing. They also have vegan oxtails. I'm so sorry, but I don't think that that's something I'm gonna try. I'm just gonna,
It might be okay for some. It's okay.
for some, like I said, I'm just gonna eat my oxtail.
Well, the other thing is fiber. High cholesterol. You need
Yeah.
to increase your fiber.
Exactly, and that doesn't say. So oatmeal, oatmeal is usually my dessert at after I eat because I eat so late. Then I eat oatmeal before I go to bed, and
Well, that's a good.
steel cut oatmeal.
That's fine. That's
Mm-hmm.
good. The thing about vegan food, though, sometimes people have this misconception that all vegan food will solve their cholesterol problems, and those Beyond Burgers and Impossible Burgers, they're loaded with saturated fat. Now, yes, they're not animal fat, but when you use coconut, when you use that coconut oil, that's 90% saturated fat. So you're kind of in the same boat. You're not harming any animals, but you're not doing any good for your cardiovascular risk either. So you have to be careful, read those labels. Oil is oil, even olive oil. They all have the same amount of calories per tablespoon. They all can jerk around your blood vessels and make you unhealthier. So if you really are struggling with cholesterol, you need to watch, you need to really ratchet down those oils, all oils.
That's good.
So that might be a little more cooking at home. Sorry, guys.
A lot more. Yeah.
Sorry. Yeah, because you can't control what they're doing at the restaurant.
No.
Unless you're gonna go to the restaurant and eat salad and ask for your dressing on the side.
Yeah, it's kind of boring, but you can put some things together. I always tell people just prep, know what restaurant you're going to. Now, if you're going to an upscale restaurant, the chefs usually make it a challenge to really please you. So you'll come back. I've had some of the best plant-based platters at some of the higher end restaurants. People look around, they got the meat on the plate. They're looking over at my plate, trying to get some of my asparagus and and yams. But really just do your homework. And one thing I found too, if I don't really know what's gonna be where I'm going, is I don't go real hungry. I have my
Yes.
healthy meal or a healthy snack before I go to the event. And then I'm not feeling like I gotta have whatever's
With
there.
food allergies, that's what I do anyway. Because I'm like, usually I can't eat it anyway, so therefore, just eat before I come, or I'll make sure I eat when I leave.
And my two smuggle products that I smuggle in at times is my dressing, because I make my own dressing with cashews and balsamic vinegar, some lemon, and and some nutritional yeast that give you a cheesy flavor. It's healthy. A lot of it has B12 in it too, which people that are vegan or whole food need to take some B12 supplement. And so I'll have those two things sometimes that I'll sprinkle on whatever food I get.
I think for cholesterol, it's important from what I'm hearing from Dr. Thompson is recipes. Get creative. I think that we do just what the few recipes you've learned and just kind of stick with this is fast. But I think if you plan and get some recipes and put in there, good low cholesterol meals, that may be a good help. And then it also will have you try new things.
Exactly, and I think that we're lazy and we will Google everything else, but we won't Google that because I understand if you didn't grow up watching somebody cook this way, then you wouldn't know how to cook a different way. Like, perfect example is the people who will cook greens all day. Those greens were done about 20 minutes into your cooking.
Yes.
And you cook every nutrient out of them, which is the water's green, when you finally get the pot open at 8 hours later.
The pot liquor. You talking this?
Right, you got to drink the pot liquor.
No, you and I, both, all of you know that you ain't got no nutrients in these greens. What is the point? You're not even eating a vegetable at that point. So you need to learn a new way of doing it. You can saute those greens, have them quickly. You can. I put them in the slow cooker. They were cooked in 3 minutes.
Yep.
It was an instant pot. And I put them at 3 minutes. I was like, oh my God. My mother goes, no way. I said, Mommy, they were done. The greens, done. They were so good. So you just have to change the way you do things. And the only way to do that, if you didn't see anyone do it, please Google it. Yeah. Google it. Just like you look up anything else. Look it up. Look it up.
And there are a lot of foodies. I mean, we've turned into foodies. There are a ton of these cooking shows. I have relatives that watch these cooking shows for hours. I mean, not healthy cooking shows, but and I'm like, yeah, you could just Google something healthy and stop having your pains and aches and taking 12 medicines by just spending a little time and learning online. Now, for me, I used to always turn to these about 4 or 5 different sources, but now since I'm into this for so many years, I know what I know. I know the seasonings I want to use. I know I'm going to have different beans every week. I'm going to have a different grain. So I rarely go to recipes now because I've picked up on what I really like and I can be creative on my own. And I try to be diverse. There was something called the American Gut Project about 8 years ago that showed that on average, if you eat about 30 different plants per week, you have a tremendously healthy gut, which means that parlays into all the other things that your gut influences, like your cardiovascular, your cancer risk, and your immunity, and your hormone balance. And so I always try when I'm shopping that periphery, when I make that right first to go to the produce section. It's usually a right, sometimes a left. Um, I know that I'm gonna spend most of my time there, and then in the dried goods section, and I'll put together some things that I know that I personally like. So it's a little tougher if you're dealing with the whole family, though. I understand. My kids are
Right.
grown. My kids are grown. I have parents tell me, well, what about my rest of my family? So,
But if you start them off eating this way, they
You
don't know
don't have
any
to change
different.
it.
that's true.
Exactly.
Because like my cousin, her daughter is 2, I think. She don't know nothing but plant based because that's the way she eats.
Best thing. I wish I knew that years ago.
So, but what I was gonna say was, Lord, I forgot. Yeah, my brain just froze on
Well,
me.
well,
But yeah, you got to be plant. You got to start them young, so then they'll be regular. It'll just be a part of what they do, and they won't know till they go to school. They will be like, "You don't eat what?" That's when they'll find out.
That's right.
well, though Dr. Thompson was talking about herbs and spices, those fresh herbs, you can grow those in your home in a
And guess
pot.
what? You don't even have to live in a place with a yard. You can grow them
You
in
do
your house.
not. You
My
do
sister
not. And it
lives in her apartment in Jersey.
and it can replace salt.
That's
Those
right.
seasonings, if you use the right fresh herbs, you don't need
That's
salt.
right.
I know what I was going to say. I didn't like broccoli. And if I ate it, it had to be doused in butter. And so, my sister's a chef. Dr. Cree, you're the only person that doesn't know me outside of in my real life. These two do. My sister's a chef, a trained chef. And so she would put the broccoli on a tray and put seasonings on it and put it in the oven. It would be so good that I would literally be standing in the kitchen at the pan eating it
Mm-hmm.
after I've already ate my plate. I'm sitting there finishing off the pan. So I did this. I did the same the other day. Ate the whole pan myself. It was so good. But when I tell you, I was like, I can eat broccoli now because I couldn't stand it.
So
Yeah,
that's being creative. That's being creative.
yeah. It's about seasoning and it's about texture. And
Mhm.
Mm.
chefs know how to do that because there are people that used to hate Brussels sprouts.
I
Ooh,
That
know.
was me.
No,
That was me.
but
Oh, that's
but
my favorite.
if you
that's my
have them
damn
done the
now.
right way, if you have them
Mm.
done the right way, you love those
Yes,
little Brussels
Mm-hmm.
sprouts.
So I
yes.
used to slice them into thin, so it was like slaw almost, and I would saute it. It was phenomenal.
That
Then I would
crispy.
make them, and I'd put bacon in them, bacon bits in them. I mean,
Mm-hmm.
I had all sorts of ways, but
A little
I
bit of
love
heat.
Brussels sprouts. But it's funny the way that we ate them as kids was awful. My sister goes, "They
Yeah.
had flavor." I go, "I know, but I liked them."
Mm-mm. I didn't like them till I started
I didn't
cooking
like
them
them till I
myself.
was a grown woman. Yeah.
Mm-hmm.
Yeah, try roasting some
Add some sauce
cauliflower
on
too.
And
Ooh.
cauliflower is
Cauliflower is
like
kind of
apple;
bland.
it can be everything.
Yeah, cauliflower is kind of bland, but when you roast it and you season it,
Mm.
it
A little
they
bit of
can.
lemon.
Some of these chefs can make cauliflower taste like those. What are those wings? Like
Oh
those
Yes,
yes.
buffalo wings.
buffalo wings. I
Mhm,
think, good
mhm.
gosh. Yeah.
We've had those. You can have cauliflower buffalo wings, cauliflower steak, mashed cauliflower, because I like mashed potatoes, so I could eat mashed potatoes every
Mm.
single day, but then I look like I ate them every day. So we just eat mashed cauliflower every day.
Oh,
Cauliflower
cauliflower
rice.
rice.
Yep.
Right.
Yep.
See?
Exactly.
You can do so much with
Sauteed.
cauliflower.
Mm.
Yeah. And it's a
Yes.
cruciferous vegetables. It's not green, but yet it's packed with a lot of antioxidants and fiber and
So
vitamins and minerals, so it's a very healthy choice too.
Things that prevent cancer.
Yes.
mm-hmm.
Because we didn't even bring up cancer. That's
Nope.
chronic.
Yeah. Oh yeah, we didn't bring up
Mm.
cancer. And but I mean, there's so many. So let's talk about the cancers that are preventable.
The major ones.
HPV.
Huh?
The major ones.
Yeah, cervical cancer,
Yeah.
Cervical,
oral
Prostate,
cancers.
Prostate
Mm.
cancer,
prostate.
colon.
Yep.
colon cancer. Yes, yes, yes.
Yeah,
And colon cancer, fiber is your best friend.
Mm-hmm.
You want to prevent colon cancer, you need to increase your fiber intake.
absolutely.
And we don't, most people's diets, they're not eating enough fiber. So here in this bottle, I have my fiber supplement. And it's in every bottle of water that I drink because I want to make sure I get my fiber. And I had my colonoscopy and they said everything looked fabulous. So it's working.
I had mine too. Age 45.
You need to
Age
call your girlfriend
45. Let's start.
Yeah.
and tell her.
That is on the list of things to do when you want to prevent colon cancer is to have a colonoscopy.
Mm-hmm.
Yes. Now, you guys, I know you see those TV commercials about Cologuard and they look oh so happy and lovely, but I'm going to ask you three would any of you tell your patient to go use Cologuard?
So I actually do. For those who are dead set against getting a colonoscopy,
That's what I was about to say.
if you're not going to get like colonoscopy is by far gold standard. You'll know what you need to do the next 5 to 10 years. But if you just don't want to do that,
It's
okay,
better than nothing.
settle
It's
on
better than
Cologuard.
nothing. Yeah.
Yeah,
That's
but
I'm
yeah,
the same way.
before I default to that, I'll share them an anecdote that my wife about 15 years ago wanted to skip the colonoscopy, and I kind of badgered her into getting it done. She was 50, and she decided to go ahead and get it done. And it turns out she had a walnut-sized cancer that she had no idea she had. There's no blood in the stool. Cologuard would have missed it. It wasn't bleeding. It was stable, but it was malignant. And
Mm-hmm.
so she didn't need any chemo. She didn't need any radiation.
Because they removed it in the
They
colonoscopy.
removed about a foot of her bowel, and the
Right.
bowel's pretty long. You can go without a foot of your bowel.
Mm-hmm.
And, you know, she's still telling me what to do every day. So
Mm-hmm.
it's a beautiful thing. And she became the poster child for all her friends and for all the family. Quit just
And
screening.
for
I
all
had
your
no
patients.
idea. I had no
That's a
idea.
beautiful thing. It's prevention and it can be treatment.
And it
Mm-hmm.
can be
It's not
cured.
awful.
It
Yes,
can be
The
cured.
fastest
can be
5 pounds
cured.
I ever had lost in my life.
Mm-hmm.
Well, yeah, get your bowel set on track for a while.
Well, and that's the
You
worst
feel
part. The
lighter.
worst part is the prep.
Yes, it is the
The
worst part.
procedure. You go to sleep. That's a good sleep.
Right.
15 minutes.
Yeah, I hate
That's a
to
great
say it. I
sleep.
look forward to it. I like
Yes.
go ahead, give me the shot.
That prep. You just got to get through the prep. And there are different types of prep. So
Right. If you, because like my mom, growing up, I would see my mom with that big thing that you added water to the powder. That
Oh
looked
God.
disgusting.
You know, they got the
I had
nerve
the
to call it
little
go
bottles of
lightly.
drink, and it was, you knock it back. It was no big deal. It was done.
Yeah, they have the nerve to call that, at least in this
Go
area,
light. Yeah,
go
so yeah, go
lightly.
lightly.
I
Yes.
tell them, you are not going
no,
lightly
you're
with
not
this
going
stuff.
Yeah,
lightly.
you're gonna be going running is what you're gonna do.
Oh gosh, I hated that. I did that one time.
Yeah, I liked my little bottles of liquid. It was clear liquid. I even put my little drink stuff that I put in my water in it. It didn't really help it, but I drank it.
As
And then
long
the
as it's
other
not
thing is,
red.
because I couldn't, because you couldn't eat, I drank bone broth, and I felt like I was eating soup. You couldn't tell me. I had it with a spoon and everything. Couldn't tell me I wasn't eating with everybody else. So it really was not that. Like I've had much worse experiences than that. That was nothing. My stupid allergy test was far worse than that. So, and it lasted longer, and that pain was awful. And so, that scratch test was a nightmare because I was allergic to everything under the sun. So it was awful.
So it's
My
not a
arms were back.
nightmare for everybody.
Well, for me because my arms and my back because
Yeah.
everything was on fire, and I was 10, and I'll never forget it. But that colonoscopy was a breeze.
Yeah.
A breeze.
Now, the digital rectal exam for men and prostate may not be considered a breeze, but it's very important,
It is very
especially,
important.
especially for black men who tend to
Yeah.
show up late for the for the exams
Mhm.
and end up having more advanced disease, sometimes more progressive. So
Yes.
we need to really be on top of making sure we have our prostate screening. Combination of the digital rectal exam and the PSA.
PSA.
That's very important. And then if you have a family history, Dr. Jones had mentioned the importance of knowing your family history.
Mm-hmm.
If you have somebody that has a history of prostate cancer, you need to have screening earlier,
Yeah.
5 to 10 years earlier.
10 years
Same
old.
with colon cancer.
And breast cancer.
And
Yes,
breast, right?
yes,
Oh,
Most all of them, I would say. If we
Yeah.
really.
let's start
Yeah,
screening early.
Yeah,
yeah.
so you can't wait, and breast cancer, especially in Black people now, you can't wait till that 40.
Mm-mm.
And look, colon cancer in a minute it'll probably be 40 instead of 45 because they had us wait until 50, and that wasn't a good idea. So now it's 45, but like I said, it'll be moved up probably in the next 2 years or something.
I believe
And
it.
and it's the standard American diet that sets us up for that. I mean, the
Yep.
standard
hmm
standard American diet has 60% processed food and about 30% meat. And the World Health Organization and American Cancer Society almost 10 years ago had overwhelming evidence. They have the way that you actually catalog evidence, A, B, C, and it was category A, the highest level of evidence basis that when you eat processed meat, you're talking about bacon, ham, sausage,
hmm
cold cuts,
Hot dogs.
the hot dogs, those increase your risk by 15%, more than
hmm
15% for cancer. So, why take those risks if you don't have to?
Hmm. Yeah, he's right. So we have to wrap up. I need everyone to let everyone know how they can contact you. We'll start with you, Dr. Cree.
You can contact me on Facebook. My page is Dr. Cree and me. I look forward to hearing from you. And we can continue this conversation for days, but prevention is the best way.
Dr. Jones.
You can find me on Facebook as well, Dr. Riddle Jones, or you can email me at lriddle@wayne.edu. So LRIDDLE at WAYNE.edu.
Dr. Thompson.
Yes, I can be located also. I have a Facebook page, Mindful Eating and Nutrition Services, Mindful Eating and Nutrition Services. And I have a website, fearlessmd21.com, just like it sounds, fearlessmd21.com. The Fearless is an acronym for holistic health. First page on the website, you'll see what that means. And then lastly, for those who are interested in any kind of online community services that for passage of information on all kinds of things, especially diabetes and prevention, healthylivingwithavision.org. That's healthylivingwithavision.org website or on Facebook. Thank you.
Thank you so much. I appreciate you all for giving us your time this evening. And we will see you on the next one, everyone. The next one is about what screenings men and women need to have
Mhm.
in different stages of life.